If you've been struggling with weight gain, irregular periods, constant fatigue, or those frustrating breakouts, and you've been told it's just hormones, you might be dealing with PCOS. In today's video, we are breaking it all down: what PCOS really is and why it's so misunderstood. So grab a cup of tea, get comfortable, and let's talk woman to woman. Welcome to Happy's Medics, where we encourage and empower women to heal naturally and confidently. Stay tuned. But before we continue, if you are new here or you've not subscribed, please don't forget to hit the subscribe button below. PCOS stands for Polycystic Ovarian Syndrome. It is a hormonal disorder that affects how a woman's ovaries works. The word polycystic means many cysts, but here is the twist: not every woman with PCOS actually has cysts. Instead, the core issue lies in hormones women with PCOS often have. Elevated level of male hormones called androgens, irregular ovulation or no ovulation at all, and small fluid-filled sacs in the ovaries, which are called cysts. This hormonal imbalance can affect everything: your weight, skin, hair, mood, and even fertility. Common symptoms of polycystic ovarian syndrome. PCOS symptoms can vary, but here are the most common red flags. 1. Irregular periods or no periods at all. 2. Acne that just won't go away. 3. Excess facial or body hair. 4. Weight gain, especially around the belly. 5. Thinning hair on the scalp. 6. Dark patches of skin on the neck or armpits. 7. Trouble getting pregnant. But here is the kicker: many women only discover they have PCOS when they are trying to conceive and can't. So what causes this hormonal storm? The exact cause of PCOS isn't 100% clear, but there are three main culprits. 1. Insulin resistance. Your body can't use insulin properly, which triggers your ovaries to produce more androgens. 2. Genetics. If your mom or your sister has PCOS, you are more likely to have it. 3. Inflammation. Low-grade inflammation in the body can lead to higher androgen levels. This condition is a mix of biology, genetics, and lifestyle. Unfortunately, it often goes undiagnosed for years. Why early diagnosis matters. PCOS isn't just about irregular periods. If left unmanaged, it can lead to serious long-term issues like 1. Type 2 diabetes, 2. High blood pressure, 3. Sleep apnea, 4. Infertility, and 5. Depression and anxiety. That's why early diagnosis is key. If you suspect PCOS, don't ignore it. Talk to your doctor, ask for hormone tests, an ultrasound, and a blood sugar test. Here is how to manage PCOS naturally. Now, for the good news, you can manage PCOS naturally. Let's look at some powerful proven lifestyle that changes that. 1. Diet. Eat more fibers such as vegetables, oats, or chia seeds. 2. Cut down on sugar and refined carbs. Include anti-inflammatory foods like berries or green tea. Healthy fats in foods like avocados, nuts, olive oil. Exercise. You don't need to go hardcore. Even 30 minutes of walking, yoga, or strength training 4 to 5 days a week can help balance hormones. Stress management. Cortisol affects your hormones. Try journaling, meditation, prayer, or just unplugging from social media. Sleep. 7 to 8 hours of quality sleep every night supports hormone regulation. What to avoid? If you are managing PCOS, here are 5 things you should avoid. 1. Sugary drinks and snacks. 2. Skipping meals or extreme dieting. 3. Processed food and trans fats. 4. Smoking.
5. High stress environment without breaks. These factors worsen insulin resistance and inflammation, making PCOS symptoms harder to manage. I'm going to answer a question that lots of people ask, which is, can you still get pregnant with PCOS? Yes, absolutely. You can get pregnant with PCOS, but it might take some planning. Here is what helps: tracking your ovulation, losing about 5 to 10% of your body weight, considering fertility treatment if needed. Don't lose hope. Many women with PCOS go on to have healthy pregnancies with the right support. PCOS is not a life sentence. Yes, it can be frustrating. Yes, it can also affect your confidence, your weight, or your mood, but it doesn't define you. With the right lifestyle changes, support, and mindset, you can take control of your body and your health. If this video helped you understand PCOS better, please give it a like and share it with someone who needs it too. Don't forget to subscribe to Happy's Medics for more health and wellness content. And remember, your health is your power. Let's beat PCOS together, one healthy choice at a time. And see you in my next video. Bye.